National Hospital wamekuja hapa, tumefanya medical camp na wao, na hata leo waziri walikuwa wamekuja kusaidiana ama kufanya medical camp, kupatiana free eye check up, na pia watu wamepewa miwani siku ya leo. Kwa hivyo tunashukuru for the partnership we have between the government and the private sector, and especially to the church. Waziri, my request will be, even as we extend the services, najua sasa maneno ya corona imekuja katika counties, we also consider the mission hospitals, ambazo wakati mwingine wanajitolea, wakati mwingine wanasaidia communities, na wanakuwa pia their resources are also zinakuwa pia wako na high demand. So zile PPE tunapeana na kila kitu, tukipata kidogo pia tunasaidia mission hospital. But I want to confirm that NHIF has really been of help to our community. Imesaidia watu kwa sababu wale ambao wako na NHIF card wanakuja kwa hospitali hii na wanasaidika. Ya mwisho, waziri, we want to thank you as the County of Murang'a for what you have mentioned pale tulikuwa na wewe, na kwanza nipeane apologies za governor wetu Mwangi wa Iria. Kwa hivyo amesema tumwakilishe, and I know there is also the representative, the CECs and his PA are here. But what we want to say, Waziri, thank you, and tell His Excellency we are happy for the commitment ya ile Kenneth Matiba Hospital, for the commitment of the contribution of 200 million to the Kegumo for Kirwara, and we know, najua mheshimiwa hajasema, he's looking forward to have a level 4 facility here in Mathira constituency. Kwa hivyo, hiyo proposal nitakuja na mheshimiwa ili tupangane vizuri. Ngorire we muthoniwa na muhakania kiragirio, na tondu hanyino hahoguo murimo uyu gwaru ha mukuruini ukirikanaga ndo Murang'a thoni na we mushie. Karibu sana na Mungu akubariki. For all of us, tuweke social distance, corona iko. Kwa hivyo tuchunge, tuirore na turoro corona ndirathio ikerakuo ni andu, tuigare social distance, twithambe moko, twikire mask, na tuthina mbere kuhoya Ngai king'uki giki gitweherere, no muno makiria twihuge na tuige social distance na tuendane. Ngai witu amurathime na ni ngatho. Asanteni sana.
Asante. Thank you very much, Mama County. Kwa sababu sasa niko na social distance ya kila mtu, ndio naweza kutoa mask. Lord Bishop, my Lord Bishop, and clergy here present, Murang'a, the leadership of Murang'a County, and I want to recognize that we have just come from Murang'a town, where we were hosted by Governor Wairia, and indeed he did say jambo. I also want to bring the greetings of His Excellency the President. Aliniambia nikifika hapo, Lord Bishop, nimsalimie, especially the clergy, and that's what I was told, especially the clergy, na viongozi wote ambao mko hapa na watu wa Kiriaini kwa ujumla. Ladies and gentlemen, I am excited to be here in Murang'a County in my continuing exercise of my assessing the preparedness of counties in combating this very dangerous pandemic of COVID-19. Let me start by extending my sincere gratitude to the people of Murang'a, led by Governor Mwangi wa Iria, for the warm welcome they have accorded us here in Murang'a, and my team from the ministry. Thank the Bishop of the Diocese of Murang'a, Bishop James Wainaina, in whose facility we now are in. Like a few other counties, I am happy to so far by the county government of Murang'a is satisfactory. And 49 isolation ICU beds facilities across the county. Isolation beds, 35 ICU beds are in place in various health facilities across the county. And the pleasing thing about that is that that means that Murang'a County is already above the 300 threshold that was mandated by the President. This is quite a commendable job, and considering that at the time of the presidential directive, the county had only a bed capacity of 96. So in a very short time, they have really scaled up. In partnership with with the Kenya Medical Training College, the county has set up an isolation center to cater for the COVID-19 cases. The county government has formed the County Response Committee surveillance teams in all the 7 sub-counties and rolled out a sensitization program on guidelines and protocols for managing and containing this virus. To ensure compliance, each sub-county, through the enforcement teams, has been provided with a vehicle to ensure that the residents observe and adhere to their containment measures. For this, I want to sincerely thank the governor and his team and urge that this is stepped up and you keep up with the good work. Indeed, in my discussions with the governor area, he did mention to me that if the necessity were to arise, they have got the ability and capability to scale up more hospital beds. I think it is also important to remember that beds alone are not enough, that we must scale up the training and facilitation of the health workers, the PPEs, that we left some even in Muranga town. The PPEs and the training of our health workers is crucial for the management of not just this disease, but also other challenges of the health nature that we face. Today, I'm also here to officially open the Kiriaini Mission Hospital outpatient block. I believe that as we launch this facility, we are witnessing the beginning of a new era of service delivery to the local community, both in the immediate future and years to come. This will ensure reachable, efficient, and faster service delivery to the residents of Kiriaini and its environs. And Lord Bishop, I will tell you that the environment about might include my village right across the river. So I also want to thank you, because I've got a feeling I'll see some of my relatives in this hospital. On the outset, I would like to extend my appreciation to your Lordship, Bishop James Wainaina, and indeed the clergy and the hospital management for extending an invitation to us to grace the opening occasion of this ultra-modern outpatient block. I am confident that the new facility in this hospital will radically improve the quality of service and infrastructure for both patients and staff. The expansion of the health facility and health services through this outpatient block is timely, particularly at this time when we are facing this unusual pandemic. This facility also comes at a time when the government is implementing His Excellency the President's Big Four agenda, which includes accelerating progress towards achieving universal health coverage as a means of realizing the right to health as enshrined in our Constitution. Fellow Kenyans, the government recognizes the outstanding and significant contribution of the Catholic Church in the country's health system. The thousands of patients you have served are a living testimony to the care, love, and support offered every day by the Catholic family. I'm glad to note that last year, Kiriaini Hospital attended to some 63,772 general outpatients, 9,031 in the specialized clinics, 3,372 hospital admissions, and 1,346 maternity services. This is in line with the hospital's mission statement, that is, to provide holistic, preventive, and curative medical services to all, with special concern to the poor and less advantaged, in the spirit of proclamation of Christ's healing ministry. However, specialized healthcare to halt and reverse the rise in non-communicable diseases, inclusive of cancers, and other diseases in general, remains a key government concern that we cannot overlook. As the government continues to enhance a multi-stakeholder and cross-sectoral collaboration under the recently signed Health Sector Partnership and Coordination Framework, I want to urge the county governments to explore the areas of partnership with faith-based organizations and other stakeholders with expertise and technology which may be lacking in our public health facilities to be utilized for the benefit of our patients. Fellow Kenyans, today there are also other events happening around the country that I would like to take this opportunity to also tell the public. I am happy to inform you firstly that in focusing on specialized treatment, the government is setting up an integrated molecular imaging center, MIC, at the Kenyatta University Teaching, Research and Referral Hospital, which is about to take off with the signing of the contract between General Electric and the hospital today. The center will be the first public molecular imaging center of its kind in the country, as well as in the East and Central African region. The center, which will be ready for use in about 9 months, will see no need for Kenyans to go to India or South Africa to access PET scan machines and other key equipment to diagnose and treat cancer. The center will also set up the first public manufacturing plant for consumables used in the PET scan machines. This manufacturing plant is called Cyclotron and is only available in South Africa and North Africa. His Excellency President Uhuru Kenyatta, having approved the project to save lives of Kenyans who wait for long periods to get proper and fast diagnosis of cancer, will be breaking the grounds of the project in the next few weeks. Equipment alone, as I had just said, is not enough, and therefore, to ensure delivery of healthcare services, we must continue training our health personnel. Indeed, the need to have specialized human resource cannot be gainsaid. I'm also glad, therefore, to announce that the government of Kenya is today receiving some from the Henry Reeve Brigade, who will be arriving in the country tonight to serve and offer services for the next 6 months. The idea here is for these doctors to work with our own doctors to gain knowledge from each other. As you know, we have been working since 2018. We have worked and partnered to improve healthcare services with the Cuban government. And this partnership has seen Kenyan doctors receive specialized training in Cuba, and Cuban doctors provide health care services throughout our country. But this particular one is a special brigade that is going to be stationed at KU. It is not going to be split around the country. And they are specialized doctors in internal medicine, oncology, cardiology, renal, and pediatrics. With the COVID-19 cases rising, these specialized doctors will go a long way in supporting our doctors in managing the disease, and also in exchanging of skill development. On behalf of the government, we are thankful to the Cuban government through Ambassador Ernesto Gomez Diaz for this kind gesture. We also want to thank His Excellency the President, through which effort we are receiving these doctors. It took a telephone call, a discussion between our president and the Cuban president for this brigade to be made available to us, and we are really grateful for that gesture from the Cuban government. We are also grateful to KU. They are the ones who are going to host them. I know they are working hard to do so. I know that the chair of the hospital, Olive Mugenda, was this morning working hard to receive them, and we are glad that we are going to have those kind of guests for an initial 3 months and possibly extended to 6 months. And therefore, as we are in Kiriaini Mission Hospital doing what needs to be done, we then have to balance so that we have got primary health care, especially the outpatient services, which then can be cascaded upwards to those kind of institutions where and if it becomes necessary. The primary health care is the most important part of healthcare in any country. And we must admit that our healthcare, our primary healthcare facilities have not been up to date. If you go to level 1, level 2, and level 3 hospitals across the country, we can't boast of the same reputation as we have with higher skilled referral hospitals. And what that has done is that we have now got people going to referral hospitals for regular infections that are easily treatable at a facility like this one. So when you have got a facility like this, it means that we are freeing Udaya Referral, PGH, and other referral hospitals across the country so that they can deal with the more challenging, areas of our healthcare facilities. Allow me, fellow Kenyans, to now turn to today's issue to do with COVID-19 and to report to you what has transpired. And I want to say from the outset, Lord Bishop, you know, there are those who think that we like to do these things. You know, we like to talk every day about these things. We don't. But we must tell you. Because if we don't tell you, you begin to think that everything has become normal. And we are not living in normal times. So don't get bored. We are not getting bored. Just listen carefully to what we are saying. Listen carefully to what we repeat every day for good reasons. And today, 389 people have tested positive to the disease from a sample size of 3,545. We have dealt with. And we have so far tested some 233,641 foreigners, while in terms of gender, once again, 260 are male and 129 are female. In terms of age, the youngest is a 5-month-old infant, while the oldest is 95. In terms of country distribution, Nairobi leads once again with some 6,761 cases. Mombasa steadying now, beginning to steady at 1,794. Kiambu growing at 666. Murang'a County is at number 23 out of 42 counties that have recorded cases with 17 only. And we would like you to stay there. I know there are 21 people who have contacted the disease here. I have just come from the Murang'a at the hospital, at the isolation facility. And I know that we have maintained, Murang'a has maintained a very low threshold. Nobody has, for instance, been treated with a ventilator machine, and so far they have been asymptomatic. And we pray to God that this continues to be the case. But the way to ensure that we do not join the ranks of those reporting very high cases is to observe the containment measures that we have given to everybody. Kwa adu aitu, adu amuranga, shushu aramari hana ende na shushu adu mamenye, kiria gikugiria adu aitu mathire, ni undu wa king'uku giki, kiria gikugiria adu aitu makue, ni undu nitukurikiriria uria thirikari irauga, nitukuona uria thirikari irauga, mundu agaikare na mundu ungi hakuhi, tondu ndui kana mundu ucio mwi nake hau, kwaja mundu wa Nairobi kana Mombasa. Ndui kana mundu ucio muri nake hau, ari na murimu uyu kana ndari naguo. Kwaja ongirora ta murore ucio murigainie, ta murore. Ungituiria muno wahota gustuka. Kwa hivyo I have to use a bit of the lingo to reach our grandmothers, since I can speak the language, and hopefully Murang'a will stay that way. Tungetaka kuwasihi watu wa Murang'a mjue ya kwamba hii si kazi ya serikali. Kujikinga si kazi ya serikali. Serikali ishabinafsisha jukumu ya wewe kujikinga, na wewe kukinga na kushunga dadako, mamako, kwa sababu ukiumbukizwa ni rahisi sana pia kuumbukiza watu wale tunao katika famili zetu. Sana sana nataka wazee, sasa sisi wanaume, sisi ndio tunaumbukizwa zaidi na hii virusi, na ningewaomba tafadhalini tufanye vile kina mama wanafanya. Ukiangalia sana utaona kule katika soko kina mama wanavaa mask. Sisi wengine ukituangalia katika pale tunatengeneza katika garage, tunatengeneza magari, unaona sisi hatuna mask. Kwa hivyo mimi nawasihi wanaume, tafadhalini, we are double, 2/3 of the infections are actually men. So I am begging those of us ambao ni wanaume, tafadhalini. Sio kusema ati nyinyi kina mama sasa muashe kwa sababu ati ni wachache, hapana. Hata moja ni mingi zaidi. Hata mama moja ni mingi sana. Mwanaume moja ni watu wengi sana. Na tunaona hata mtoto mchanga wa miezi 5 hata yeye pia ameumbukizwa. Na nikiona ile adwaitu wona yanakana kanini waciarwo kana atimia ati ai guthie ngeiricio muthenya ucio kuraciarwo kana mugatengera nakuo na marigo na igwa na ke uguo ni gundu wikaga kawaida na ni wega, no kahinda-ini gaka bai mutige gucerera kana mugeni ucio reke ogithio ni nyina, nawe nyina kana tiga guthie thoko utari na mask, tondu wathio wanyita murimu ucio ukiongithia mwana ni akugia ni akurwara. Na koguo kahinda-ini gaka ri we tuma kindu wakona mwaka utumire nyina kana kindu ri tigana na igwa ona mutu tigana naguo, tuma M-Pesa ni akuigurira. Yotigwa andu aitu kana iye murona atia atimia githe tinyi mutago cio wira murona atia inyui githe tikaba M-Pesa kabaguo niona ni wenda kunyona ndumiro cio tiga utidoki jerera muno. As I conclude, while acknowledging the good work and support by our religious leaders in collaboration with the government towards restructuring the opening of places of worship, I want to really appreciate and thank the Inter-Religious Council led by Nyeri Archbishop His Grace Anthony Muheria for steering this process in an extremely commendable manner. And I want to thank our spiritual leaders because of the manner in which they have conducted themselves since this COVID-19 was announced. And I look forward to working with you continuously in ensuring that we do not do what happened in Italy, what happened in South Korea, because of the care and observation of the protocols that we have together worked with. And I look forward to fruitful outcomes following the completion of their work. Finally, ladies and gentlemen, it is now my pleasure to step up and declare this block officially open. But perhaps before we do so, since we have not come back here, I would like to give an opportunity for the members of the press to ask one or two questions for any clarification that you may need.
Thank you so much, Waziri. My name is Melita Oletenges from NTV. My question is, we have health workers who have contracted COVID-19 in the line of duty. Perhaps how is the government compensating them and those families whom have lost their loved ones in the line of duty? How is the government compensating these people? Thank you.
Waziri, jina langu ni Emmanuel Talk kutoka KTN News. Maswali mawili. Leo hujatupa idadi ya watu ambao wamepona na wale ambao wameaga dunia. Naomba tupe habari hizo. Alafu swala la pili, tumekuwa na tetesi kwamba kuna vituo 20 ambazo zimeweza kufungwa za kuweza kupima virusi vya Covid-19. Je, habari hizo ni za kweli ama si kweli? Alafu je, jambo hilo linawacha vipi wale walalahoi ambao hawezi lipia ada ya kuweza kuchunguzwa katika zile hospitali za kibinafsi? Asante.
My name is Robert Gakure, Mount Kenya TV. My question is, how well has the government put measures to ensure that other Kenyans are not put at risk in regard to home-based care, especially now that the borders remain open and there is easy movement? Thank you.
Asante sana. Thank you very much. First and foremost, yes, you are right, Militi. I did not mention the number of deaths today. That's an oversight on my part. Today we have lost 5 patients across the country, and most of them, at least 4 of them, were people with underlying issues. Most of them, most of that being diabetes or diabetes in as well as hypertension together. As for our health workers, we are very determined that our health workers are taken care of in a normal manner that we do. Health workers are taken care of in a normal manner that we do in terms of not just supply of PPEs. As you know, we even opened a new ward at Kenyatta National Hospital, specifically specialized and just kept aside for our healthcare workers. But I would also like to say that even when it concerns our health workers, most of the ones who have had infections are fairly asymptomatic. But I'm going to ask Dr. Amoth, as he talks about home care, to also talk to that issue that you have raised. As far as the laboratories are concerned, I want to say that we have not closed any laboratories at all, but we have discouraged people who have no symptoms of any kind to simply walk into Kenyatta and say that you want to be tested. We want to focus on targeted mass testing, not just everybody and anybody. So on home-based care, before you get the details from Dr. Amoth, let me just say this. Especially in rural areas, home-based care is the best way of us managing our people. The reason why originally we did not want home-based care was 2 things. A is a good understanding and guidance from World Health Organization, which we did not have at the time that COVID was announced. So that was one reason why we were keeping everybody in the hospitals. That's number 1. But number 2 is we believe that we have impacted sufficient knowledge now amongst our people, and we continue to train through community health workers. Yes, we have trained now some over 37,000 community health workers. And this idea, this is to cater for those who are going to be at home. We want to roll out training now to even family members who are taking care of others at home. The guidance we have been given by the World Health Organization are clear. We have adopted some of the protocols to suit our particular environment. For example, where we have got very densely populated areas, we will continue to have isolation facilities supplied by the government. But where that is not necessary, then it is be better for people to be taken care of by family, especially where the family members themselves are also well trained and cannot get the virus. So, Dr. Amoth, maybe you can explain a little bit more about the specific protocols of home-based care.
Thank you, Waziri. As Waziri has indicated, home-based care guidelines came into place just about 6-7 weeks ago from the World Health Organization, and this was informed by the fact that a significant number of cases of COVID-19 were actually asymptomatic, and therefore it made business sense using trained healthcare workers that you could be able to manage these people at home. Based on that, the WHO set out criteria or guidelines for those who qualify for home-based care. Internally, as a country, we adopted these guidelines through our case management team, and we came up with a criteria. Of course, number one is that you must have a positive COVID diagnosis from a recognized laboratory. Number two, you must be asymptomatic. You are positive, but you don't exhibit any symptoms. And number three, you must not have a pre-existing medical condition, such as diabetes, hypertension, cancer, or anything else, because if you have a pre-existing condition, you will tend to get a more serious form of the disease. But then you must have a place, either at home or in your house, where you can be able to isolate from the rest of the family. It must be well ventilated, preferably with a separate toilet and bathroom facilities for better hygiene. Then there must be nobody else in that home who is more than 60 years old or who has another pre-existing medical condition. You must have a caregiver that you can be able to train, who can be able to check your temperature, who can be able to deal with infection prevention control measures, including disposal of masks or any other secretions. Then on top of that, the caregiver must give you support in terms of providing your meals, cleaning services, and many other raft of measures that are clearly spelled out in the home-based care guidelines that we have shared with the counties, and we have gone ahead to translate it into Kiswahili. And we have appealed to the county governments to ensure that we have an abridged version of the ABC of home-based care that is in a local dialect that anybody else can be able to understand. Because home-based care now will be offered by the community health volunteers and also members of the household. It is imperative that we go this way because as our numbers increase, the cost of caring for a COVID-19 positive case who is simply asymptomatic, if you had to put you here, for example, on average you'll spend 21,000 shillings just to monitor you without giving you any medicines, and 65% of that cost will be because of use of PPEs. So if you can be able to take care of you at the home level, psychologically you are better prepared to be able to recover best at home in a home environment compared to institutional environment. And with that, we have also trained the healthcare workers through an electronic module. The community health volunteers training is still ongoing throughout the country to be able to ensure that this is successful. We also have put a strict monitoring and evaluation tool to be able to see the performance of home-based care. And so far, the clients we have put on home-based care have all recovered. We have not recorded any mortality from home-based care. For example, today we have discharged 1,126 people. And out of these, 781 cases are from home-based care and only 345 from hospital or institutional care. So this is the direction we want to take, hoping and praying that majority of our people will still be asymptomatic. And this is something that we have done before in the advent of HIV/AIDS, where we practice home-based care with very good success, and we believe with the sensitization of the healthcare workers support of the community health volunteers, support of the communities, we can be able to do it again. Thank you.
Thank you very much. Before I hand over to Bishop Wainaina, who I'm sure you want to say something before we proceed, let me just take this opportunity, if you allow me, Bishop, to just introduce one or two people that you might really want to know. For example, Bishop, because your hospitals are connected with NHIF, and I know that you have been saying there is a little deal that is pending, the culprit is here behind me. This is Dr. Peter Kamunyo. He is the CEO of the NHIF. So you can have a one-to-one, you know, after this. We have obviously met Dr. Amoth from the Ministry of Health, who is our Acting Director General of Health in the Republic. I don't think you have met this gentleman called Mamo. Mamo, if you step out there, maybe they can see you. That gentleman you see there works in the National Lab, Influenza Lab, and he is the one who looks after the samples that go there. When a sample is taken to Nairobi and they want to know whether you are positive or negative, this is the man who determines. And I can assure you that you can't bribe him to give a different result from what it is. I think the other one is Dr. Thega. Was Dr. Thega here? Yes, Dr. Thega is here as well. He is also in the ministry in the area of healthcare services. And these are the people who work behind the scenes to make the ministry successful. Nani mwingine iko daktari hapa? Dr. Nandiri. Dr. Nandiri huyu ndiye mkubwa wa nurses zote katika nchi yetu ya Kenya. Kwa hivyo pia our nurses are recognized as part of a very key leadership role in healthcare facilitation. So unless if I forgot somebody, please allow me to stop there. I also want to take this opportunity to just mention a small thing about Kazi Mitaani and to say how grateful a lot of us are with the President's initiative of Kazi Mitaani. As I was coming from Murang'a town, I witnessed them myself. I saw them doing incredible work in the county, and we hope that this is something that can continue. Let's also utilize Kazi kwa Mitaani to expand our environment, plant trees, and so on and so forth, so that we can benefit from that particular activity. Bishop Wainaina, I'll hand it over to you now, so that perhaps you can say something before we go to open officially the hospital.
Thank you very much, CS Honorable Mutahi Kagwe, CS for health in our country. I recognize the presence of the Mama County who is here, and also the Member of Parliament, and all the county and national government leaders who are here with us. I also want to recognize in a very special way Right Reverend Bishop Joseph Mbatia, who is here to bless for us this facility, and all the others, all protocols observed. Karibuni sana, and I thank you very much. And I start with that note, thanking everybody for coming, and particularly you, our chief guest, who has accepted to come to be with us for this opening of our OPD. It has been a big effort that has called more energies than we can give ourselves, and therefore I also want to thank those who have supported us in one way or other, so that we could be able to come up with this OPD, and also the other improvements that we have done in this hospital. I wish to recognize particularly the partnership that we have had ourselves here in our diocese, but also in our country, between the government and the church. It is true that it is our mandate, we feel that it is our mandate, we as the church, to take up the work of Christ as he has shown us in his life. But without the good environment that we have enjoyed, where we are able not only to give our efforts but to feel supported in many ways by the government, we would not have gone far. And I therefore want to thank yourself, Honorable Mutahi Kagwe, and through you, the President and the government, because of this partnership that we have had. We are opening today the OPD. And this is not the end of the road. We have other things that we would want to do, but we are always handicapped, as somebody has said, because we spend a lot of our funds subsidizing for those who are not able to cater for their fees and for the services that are rendered. I therefore wanted to turn to you on behalf of the government, as you have come to be with us, Honorable Mutahi Kagwe, to ask if we could be supported in a number of things. We are spending a lot of money going to fill up our cylinders with oxygen. We wish that we could have an oxygen plant in our hospital. And also our X-ray machine is not only analog but a little bit old. And we have to, it takes a lot of time to have the exposures analyzed. So we are asking if it would be possible to be assisted with a digital X-ray. Even a small one, we don't mind, but if it is digital. We also feel that this area we don't have an MRI. The nearest is in Madari, and that is quite a number of kilometers away. In fact, in Central Province, we have just a few of these. We are asking if it would be possible for the government to assist us with that. And we would therefore be serving all those who are surrounding us, and even those who are far afield would be coming also to benefit from that. And I can tell you it is true that our hospital serves not only Mathioya area, not only Muranga and the adjoining Nyeri County, but also patients seen coming from far, from different places in our country for treatment that is given in a special way because we are God-fearing people. I also would want to ask the county government. We accept and we know that the governor could not be able to be with us because of his schedule, and I wanted to appreciate the cooperation that has been there with the county government. On his behalf, there is his PA who has come to be with us, and I would want to send through him a message of appreciation and gratitude, while also asking to be assisted with 2 medical doctors for this hospital. As we come up with this enlarged OPD, you need more doctors. So 2 doctors, you could give us 2 doctors here in this hospital, and possibly also a doctor for our Gaichanjiro. The 2 hospitals, this one, your honor, this hospital Kireine plus Gaichanjiro, make a good proportion of all the health services that are given in our county. And I therefore even ask for Gaichanjiro that it could be given a doctor if available. And also turning to also to the person in charge of the nurses, and also from the county, asking that we be given nurses who can help in OPD. That is, 5 nurses for Kiriaini Hospital, and possibly also 2 nurses in our. And then I also ask Dr. Peter, who is here. Your support has been there, and we have always noted that you are supporting us. NHIF is one of the arteries through which we are able, even faith-based facilities, to be able to receive our funds and continue, and therefore to have speed the processing of our claims and also our payments. And also additional equipment, I am sure that there is a possibility of the NHIF supporting some institutions in this manner. And I ask that too. When I come to you, when I knock your door, kindly open for me. CS here, we also wanted to change the entrance because it is very congested, as you can see, so that it can move a little bit along the road. And here we are asking also for those who are in charge of logistics to help us so that we can be able to move it a little bit down this way, so that we are not obstructing, or rather our patients as they come in are not obstructed by other business things. Let me take this opportunity once again to say thank you very much for coming. There are many people I should have also mentioned who have come. Unfortunately, because of the tight schedule that we have, and especially our chief guest, will not be able to have that. But I want to ask you to accept my humble appreciation, my thank you, whoever you are and whatever you have contributed and you are doing in this gathering or before, or even those that we are asking that in the future you support us. So thank you very much, everybody. God bless you. We shall now continue to do the blessing, the opening and the blessing of the facility.